All right, so that's a good way to get decapitated. And that's how coronavirus was created. Hey everyone, welcome to our very first video, Movie Diagnosis. I'm Dr. Dustin Harris, and a little bit about myself. I'm an emergency medicine physician and professor of emergency medicine. On this channel, we diagnose illnesses and injuries in all of your favorite movies. And this is our first video, and our first movie is going to be 1993's Jurassic Park, directed by Steven Spielberg. So without further ado, let's get right into it. And as always, spoilers ahead. All right, so this is our first clip. This is the beginning of the movie, the cattle prod scene. So let's get right into it. So quick clip, just wanted to set it up. So you see multiple workers, I guess, for Jurassic Park holding cattle prods with their bare hands. No rubber gloves or anything. We don't know about these cattle prods, but the best-selling cattle prod on Amazon for about $50, if you're wondering, generates about 8,000 volts. So electrocution injuries can cause irregular heart rates, arrhythmias, burns, or kidney injury. There is more electrocution later. Spoilers. But just briefly, if you're handling a cattle prod, please wear some sort of protective handwear, gloves, to increase the resistance. All right, so for this next clip, it's the shoot her scene where the, well, let's just watch.
Joffrey, raise the gate!
All right, so a lot happening in this scene. Definitely a lot of electrocution injuries to the Velociraptor, but we won't cover those just yet. Initially, poor Jeffrey, he's lifting that heavy gate without using his legs. Very poor posture. So if Jeffrey was to survive this whole ordeal, he may have some chronic back issues from the way he's been lifting all these years. That could lead to lumbar muscle strains as well as intervertebral disc herniations, all which may require physical therapy all the way up to surgery. There are also bites later in this movie, so we'll just cover the initial non-fatal bite when the Velociraptor grabs a hold of his ankle, foot, or leg. So all animals have bacteria in their mouths. That's where the bacteria belongs. But when you receive a bite or when you bite somebody, that bacteria can transfer into the part of the body that you are biting. So whether it's a human or an animal or a reptile, which is an animal, the patient usually needs antibiotics. You want to clean the wound very well. Reptile bites usually need a specific antibiotic called a fluoroquinolone because a lot of reptiles have the bacteria Salmonella in their mouths. You usually don't repair bite wounds unless they're very extensive or they're on sensitive areas like the hands or the face. Okay, so this next scene is when we first meet Dr. Hammond. He's arriving in his helicopter. There aren't any injuries in this scene, but there are a lot of what I'll call hazards, things that, to keep you safe, you should learn. All right, so that's a good way to get decapitated. So approaching a helicopter as it's powering up or powering down could lead to you getting your head chopped off. As you can see, the wings of a helicopter, or many helicopters actually dip down when they are in the power down or off position. So as they're starting up or powering down, the wings will oscillate and they can actually dip lower, and they actually could take off your head because they're spinning so fast. And a decapitation is something we cannot fix yet. I do think in another country there was an attempt at a head transplant that did not work, but who knows where we'll be in 5, 10, 20 years from now. Also, all the sand and debris and rocks flying around from the helicopter wings and the wind that it generates could lead to eye injuries. So you should wear sunglasses or protective goggles in that scenario. Now, why do I know anything about helicopters? Well, during my residency in Chicago, we did fly and transport patients in helicopters from around the city. And that could be anything from just traveling hospital to hospital or landing in the middle of a field to pick up a critically ill patient, because sometimes helicopters are faster than an ambulance, depending on traffic or weather. But those days are long behind me. But it was a lot of fun and I learned a lot, but you had to do a lot of safety training and learn about all the different ways to approach helicopters, what to do if the helicopter went down, what to do if the pilot was unable to fly the helicopter anymore, how to shut down the helicopter in an emergency, what to do in a fire. So if you're looking into possibly being a helicopter medical professional, definitely beware. There's a lot of safety concerns, but it can be very rewarding and also very fun. This scene is a little disgusting, so if you're squeamish, maybe don't watch this part.
That is one big pile of shit.
Right. There's no trace of lolly berries. It's so odd, though. Alright, so she's suffering from neotoxicity. Every 6 weeks.
E. coli, adenovirus, Coxsackie, hepatitis A, Shigella, Salmonella, all bacteria and viruses that live in feces. Do you see any sinks around there? Disgusting. Wash your hands, please. All right, for this next scene, there are 2 quick injuries, but pay very close attention because there's a lot to talk about, and it's also one of my favorite scenes.
Ian, freeze! Get the tank!
All right, so 2 very different injuries. We have one penetrating trauma and one blunt trauma. So the penetrating one first. So that lawyer is definitely dead. He gets eaten by a T-Rex. But let's say he gets bitten once and the T-Rex is like, oh, lawyer, I don't like the taste, spits him out. Now, what do we do? So he has penetrating injuries. It seems like the front of his lower abdomen, mid to lower abdomen, and maybe his back as well. So pretty straightforward from the emergency medicine standpoint. The patient needs to go to the operating room. Possible injuries include bladder rupture, intestinal perforation, splenic rupture, liver rupture, possible vessel injury to his aorta or his inferior vena cava, especially with the bottom teeth penetrating the back, his back. Now, if when he arrives to the hospital, he's actually stable, then he may go to he may get a CT abdomen pelvis to better assess the injuries prior to going to surgery. But once he gets to the ER, I'm gonna call the trauma surgeons and have them take a look at him and hopefully save his life. All right, so the next injury is a blunt trauma. So Jeff Goldblum gets hit by the T-Rex and flies through the air and lands, and he's unconscious. Now, he could have any number of injuries. I usually cater what I'm gonna order, what I'm gonna do next, depending on what the patient looks like when they get to the emergency department. So let's say he's unconscious. Well, the less the patient can tell me, the more tests I order. Here's a graph. But if he's awake and he's able to tell me where he's having pain, then I may order tests based on where he's having pain and also assess his abdomen and his chest, because a significant blunt force trauma, you can kind of picture like getting hit by a car. So there could be a lot of injuries, there could be small injuries that could turn into larger injuries later. So he's gonna need a lot of imaging, CT imaging, and then possible consults on from there. Now, a tool we commonly use in the emergency department is the ultrasound machine. And yes, it's not only used to look for babies. Some smarter emergency medicine doctors and I have developed a fast scan protocol, which is a focused assessment with sonography and trauma. And that's to look for any accumulating fluid, possibly blood, in the abdomen or the heart or the thorax, very quickly, faster than a CT scan. You place the probe in strategic locations to look for accumulating blood or abnormal hypoechoic or black shadowing fluid. We're gonna have two examples right down here. The example on my right, your left, is going to be a normal fast scan, so there is no fluid accumulating. So we put the ultrasound probe first on the heart to see if there's any fluid accumulating around the heart, then in Morrison's pouch, which is the hepatorenal recess, and then on the left side of the patient, the splenorenal recess, and then you also look around the bladder for fluid there as well. And then here on my left, your right, you're going to see an abnormal fast scan with accumulation of fluid, and that's that dark hypoechoic black image that you characteristics that you see within that image, and that's abnormal. Now, what do you do if your fast scan is what we call positive, or you see some fluid? That fluid could be anything, could be blood, could be urine, could be accumulation of fluid from the lungs or lymphatic ducts. So if they're stable, then you probably would get a CAT scan for more detailed imaging. If they're unstable, straight to the operating room for exploratory laparotomy or XLAP, and that's where the surgeons will cut you open and look for any injuries and repair what they can to help stabilize you. All right, so if you thought you weren't going to learn anything about dinosaurs today, you are incorrect. So this next clip involves the Dilophosaurus, and let's jump right into it. So Newman kind of deserved that. Unfortunately, he wasn't wearing his glasses to protect himself from the Dilophosaurus venom. So, fun fact, we do not know if the Dilophosaurus spat venom. The fossils aren't able to tell that much information. So I looked up probably maybe the closest thing we could think of that was close to possible Dilophosaurus venom. And so the Komodo dragon actually has a venomous bite, and that bite can cause inhibition of coagulopathy, meaning you have trouble creating clots, so you have increased amount of bleeding. It can drop your blood pressure. It can lead to you having a lower body temperature and also cause shock. There's no anti-venom for Komodo dragon bites, possibly because there's so few of them. So you treat the patient symptomatically. So if their blood pressure is dropping, you give them fluids. If they are becoming more cold or having hypothermia, you warm them up. And if you are seeing that they have increased amount of bleeding, then you give them kind of clotting factors back. You can give them plasma or cryoprecipitate, or give them back platelets, all to be transfused, kind of like transfusing blood. So you kind of treat them what we call supportively. You treat them by their symptoms, depending on what they're having, because there is no anti-venom for Komodo dragon or Dilophosaurus venom.
Come on up here, girl. Come on. Up here. God bless you!
And that's how coronavirus was created. All right, so a long-awaited electrical injury that I mentioned earlier in the video, and here it is. All right, so luckily he was okay and the rest of the movie, but there are many injuries that he could have suffered. There are burns, muscle injury, compartment syndrome. You could have kidney injury. You could even have cardiac arrhythmias. So how we work those up. So cardiac arrhythmias, you would want to get an EKG, check the patient's electrolytes. Burns, superficial, you just try to see where they are. Compartment syndrome, for those of you who don't know, that is where you have increased swelling or increased tissue mass within a compartment in your body where there's nowhere to go. So if you have increased swelling in your muscles or bleeding, they are each in their own compartments. And if there's nowhere to go, then they could have increasing pain that could cut off your vasculature or even your nerve sensation. So sometimes you have to cut open the skin to allow for that compartment to be opened and for the swelling to continue. It looks like he didn't have any compartment syndrome symptoms afterwards, but he would probably need lab tests to check his kidney function. And the fence definitely had more than 600 volts, and that's my cutoff for admission to the hospital. There is also alternating versus direct current, AC versus DC, just like the band. Alternating current can be more damaging because sometimes the muscle will spasm and you can't let go of the source of electricity, but direct current is more direct. The electric fence was probably direct current, which is why he was able to let go and he flew off and fell to the ground, which also could cause any sort of blunt trauma or fall trauma to his legs or back or his butt. All right, we made it. It's our last clip, so prepare yourself. Oh, Laura Dern, what a legend. Given a hand to the acting performance of Samuel L. Jackson's arm. So in this scene, we can assume Samuel L. Jackson is dead, but let's say he's not. We really don't have any proof that he's not dead. He may be bleeding somewhere, but he could still be alive with an arm amputation. He may be enjoying a Royale with cheese somewhere safe. But what do we do with his arm if we find him again and we want to reimplant it? How do we transport that arm? I've seen a couple finger and toe amputations, but never a full extremity. But if someone was trapped in a car or their arm was trapped under a boulder, just like in 127 hours, how would you want to transport that amputated limb if you were forced to amputate? Should you put it on ice? Well, yes, that's correct. You want to put the arm or digit on ice, but not directly on ice because that could cause frostbite. So you want to wrap the arm in wet gauze with water, preferably saline, and place that on ice in a bag for transport. Now, fingers and toes can last about 24 hours without being attached to the body, whereas larger limbs can last up to 12 hours, 24 and 12. Why is that? Because smaller digits need less oxygen before they start having ischemia or necrosis, whereas the larger limbs require more oxygen. So once they get to the hospital, you want to call your limb salvage team, whether that's orthopedic surgery, vascular surgery, plastic surgery, or maybe a combination of them to help reattach the limb, possibly reattach the vasculature or bones together if it's still salvageable. All right, that's it. That's our first video, first movie, Jurassic Park, the classic. A great variety of injuries, so I'm gonna try and incorporate that into future movies, not just the same injury over and over and over. Good variety means a lot of variety of learning. So if you like the video, please like, subscribe, comment. Please give me your feedback. I'm hoping to make these videos better every time. This is definitely a learning process, something I'm not familiar with. I'm trying to get these out maybe once a month. Hopefully you like them. And just remember, it's medical practice, not medical perfect. And have a good one.